If you're a dog owner, you know that feeling, right? That absolute sickening jolt of panic when your dog is suddenly sick or injured.
Mm.
And in those first few minutes, you're overwhelmed. Yeah. Is this just an upset stomach, or do I need to drop everything and race to the vet right now?
And that exact spike of stress, that confusion, is what we're here to cut through today. This deep dive is all about giving you the knowledge to act and act fast.
It's about getting clarity when your head is just full of adrenaline.
Exactly. Our mission here is to teach you a kind of rapid triage. We need to draw a really clear line between the immediate emergency go now situations where minutes, literally minutes, can cause permanent damage,
Right.
and the urgency vet within a few hours scenarios where you have a little bit of breathing room.
Okay, let's unpack this. We are starting with the absolute top-tier red alert threats, the signs that tell you something is failing right now.
Precisely. And at the very top of that list, the highest priority is always breathing. If your dog is gasping for air, if they're choking, or you hear this severe ragged coughing or wheezing, you have only minutes.
So what are the visual cues? For the owner who's panicking, what do they look for?
Check the gums. Lift up their lip and look at the gums or the tongue. If they're blue or even purplish,
Okay.
that's called cyanosis. It means oxygen deprivation is happening right now. It's a dead giveaway that the system is failing.
And what about the breathing itself, the movement?
You'll see this labored breathing where their whole chest and even their belly is heaving with every single breath. It's a real struggle.
That can be hard to spot sometimes, right? Especially on like a big barrel-chested dog.
It can be. So a subtler sign is open mouth breathing when the dog is totally calm. If they're just sitting there, not hot, haven't been running, and they're panting, that's a huge red flag.
Because they can't get enough air through their nose.
Exactly. And the timeline here is just, it's not negotiable. A few minutes of that can lead to brain damage or worse.
Okay, so if it's not breathing, the next terrifying thing is probably a collapse or, something neurological.
Yes, sudden fainting, the dog just drops. Or they can't stand up, they can't walk. Worse, they're not responding to their name, to your touch.
And what does that signal?
It signals a systemic crash. It could be anything from severe internal bleeding to a heart problem, poisoning, and seizures, of course, fall right into this category.
Right, the convulsions, the paddling legs, that's terrifying to witness.
Mm.
But a lot of seizures are short.
Mm.
When does it cross that line into a life-threatening crisis?
It's all about the clock. This is so important. If a seizure lasts for more than 3 to 5 minutes,
3 to 5, got it.
that is an immediate emergency. That prolonged seizure activity generates so much internal heat that it literally cooks the brain. You cannot wait to see if it stops.
Wow. Okay, that's a powerful reason. Let's pivot to trauma. Obvious things like getting hit by a car, but also the bleeding that comes with it.
Yes. For external bleeding, if you put firm, direct pressure on a wound and it just won't stop after 5 solid minutes,
5 minutes.
that's a life-threatening bleed. You're heading towards shock and the clock is absolutely ticking.
But the really scary one is internal bleeding, right? The one you can't see.
That's the silent killer. You have to look for the other signs. The gums will be extremely pale, almost white. Their pulse will be really fast, but feel weak or thready.
And the big one.
The big visual is a swollen, hard, painful abdomen. If their belly feels tight like a drum, that's a sign of massive fluid buildup inside. That or an inability to urinate despite trying. That could be a ruptured bladder. Both are. Go now.
And what about GI issues? I mean, vomiting, diarrhea. Every owner deals with that. When does that become a 5-alarm fire?
It's about the severity and the other signs. If your dog is vomiting, say, more than 2 or 3 times in just a few hours, that's a concern.
Okay.
But if that vomit contains blood or, and this is a key sign, if it looks like coffee grounds,
Coffee ground.
it's dark, it's granular, it means the blood has been digested from somewhere high up, like a severe ulcer. That's a sign of a major hemorrhage. Same with stool that's black and hairy.
So if you see those signs, especially combined with like weakness or
In the
collapse.
crisis, it could be a blockage, a toxin, severe dehydration. They need IV fluids and they need them immediately. You have to look at the whole picture.
Right, the whole picture. Okay.
Yeah.
Here's where it gets really interesting, because I think these next two are where people lose the most time just by misidentifying the symptoms.
Absolutely. We're talking about heat stroke and bloat.
2 of the fastest killers out there.
They progress so rapidly that recognizing the signs early is everything. So for heat stroke, you're looking for that heavy, frantic panting, but with a really dark red, almost brick-colored tongue.
Dark red tongue. Okay.
And thick, excessive drooling. Then it quickly progresses to vomiting, diarrhea, and then collapse.
And the official crisis point is a temperature over 104 Fahrenheit.
Yeah.
Right.
Hmm.
But, I mean, who has a rectal thermometer handy at the dog park?
That's a great point. So if you can't take the temperature, you rely on those other cues, the sticky saliva, the severe lethargy. Once their body hits that temperature, organ damage starts happening within minutes. You have to start cooling them down while you're on the way to the clinic.
Okay, then there's suspected poisoning. This one is tricky because it can look like anything.
It can, but the big tell is a sudden, unexplained neurological change. We're talking tremors, muscle twitching, seizures, or that excessive drooling and foaming at the mouth.
And what about their eyes?
Check their pupils. Are they suddenly huge and dilated, or tiny and constricted? Any sudden weird change like that after they've been, say, out in the yard? You have to suspect a toxin.
And you just have to act fast.
Incredibly fast.
Yeah.
For things like rat poison, the antidotes are only effective in the first hour or two. Don't wait for symptoms. If you see them eat something they shouldn't, get on the phone and bring the box or the plant with you.
Right. Okay, now for the big one, especially for owners of deep-chested breeds. Bloat, or GDV.
Gastric dilatation volvulus. This is one of the most urgent surgical emergencies we see. The stomach fills with gas and then twists on itself.
And a lot of owners might just think, oh, he's got bad gas. How do you tell the difference?
The twist. The twist is the catastrophic part. The number one physical sign is a rock-hard, drum-like abdomen. If you tap on their side, it sounds hollow and tight.
Okay.
But the absolute hallmark symptom, the thing you have to look for, is their behavior. They are trying to vomit, but nothing is coming out.
The dry heaving.
The dry heaving, that's the key. They're restless, pacing, drooling, and retching over and over. That means the stomach is twisted shut. It's cutting off its own blood supply.
And that's fatal within hours.
Sometimes less. Without immediate complex surgery, it is 100% fatal.
Okay, so we have covered the absolute go-now category. Now let's contrast that. Let's talk about the urgency vet within a few hours list. What falls in there?
Right. So these are still serious, but they're not typically situations where 5 minutes is the difference between life and death. You have time to call your vet, get organized.
So what's a good example?
A big one is not eating or drinking for a full 24 hours or more. That's definitely urgent, but the dog isn't actively crashing.
Okay, what else?
Severe limping. Unable to put any weight on a leg. It's awful, it's painful, but a broken leg is rarely an immediate killer. You can stabilize them and transport them carefully.
And you mentioned the painful abdomen before, but not the hard drum-like one.
Exactly. A belly that's just tender to the touch could be pancreatitis or something else, but it doesn't have that lethal, rigid tension of a GDV. That's a key distinction.
What about some of the more systemic things?
Yeah, the chronic alerts,
Yeah.
like excessive thirst and urination all of a sudden. That could be kidney failure or diabetes. Or those discolored gums we talked about. If they're pale but not paper white, it could be chronic anemia.
Or yellow.
Or yellow jaundice, which points to liver failure. These things are all very serious, but they usually give you time to get to your regular clinic during hours, or at least prepare for a trip to the ER without that blind panic.
Right, which actually helps because a calm, prepared trip is safer for everyone.
100%.
So let's get into that practical side. You've identified the problem. What are the critical things you need to do before you even walk out the door?
The single most important thing is to call ahead. Call the clinic.
Why is that so crucial?
Because you can give them a heads up. You can say, I have a Great Dane, he's dry heaving, I suspect bloat. That lets the team prepare. They can get the OR ready, get fluids going, mobilize the staff. It shaves precious, precious minutes off the intake process.
They can basically meet you at the door ready to go.
That's the goal. And
Yeah.
you can ask them for first aid advice. They might tell you how to start cooling a dog with heat stroke, for example.
Okay, what about getting them there? Safe transport.
The main rule is minimize movement, especially with trauma. Use a blanket as a makeshift stretcher. Try to keep their head and neck stable.
And what if they're in a lot of pain?
A dog in pain might bite, even their owner. So you might need a makeshift muzzle, but make sure it doesn't restrict their breathing at all. And if you possibly can, have someone else drive so you can monitor the dog.
That makes sense.
No.
And finally, what do you need to grab on your way out?
Okay. 3 things if you can. 1, a list of their current medications. 2, a sample of the vomit or stool, if that's relevant.
In a baggie.
Yes. And 3, and this is the most important for poisonings, the packaging, the box, the bottle, whatever it is. Knowing the active ingredient can literally save their life.
So what does this all mean? We've kind of boiled this all down into a clear framework. The big takeaway seems to be that quick, informed action, based on what you're seeing, is what saves lives.
That's it, exactly. And I want to leave you with two guiding principles. First, trust your gut, your instincts. If a situation just feels deeply wrong, it's always better to have a vet check a healthy dog than to wait too long on a critical one.
Better safe than sorry.
Always. And second, remember what's failing. If it's about oxygen, blood flow, or the brain, then time matters every second. Don't wait to see if it gets better.
Because it probably won't.
It won't. And remember that prevention is part of this too. Keeping up with vaccines, securing toxins, avoiding exercise in the middle of a hot day.
So beyond just knowing all these symptoms, the most prepared owners, the ones who are really ready, have their contacts sorted out before disaster strikes.
Yes.
So the final thought for you listening is this. Do you have a number for your regular vet, for the 24-hour emergency clinic, and maybe even a pet ambulance service saved in your phone right now? Because that simple preparation, that's the final layer of protection your dog has.